Assalamu alaikum. My name is Hania Rashid. My roll number is BP1650081. The topic of my presentation is Cephtrioxone. So let's start it. So our drug is Cephtrioxone. What is Cephtrioxone? Which is a broad spectrum third generation cephalosporin antibiotic, which has very long half life of 5.8 to 8.7 hours and is primarily eliminated in the urine. It has high penetrable strength into the meninges, eye, air, and inner ear. It is reversely bound to plasma protein, but unbound fraction increases with higher doses of ceftriaxone. Okay, so what is the rationale use? Rational use of ceftriaxone is found in many kinds of bacterial infections like respiratory, skin, UTI, ENT infection, other bacterial infections like pelvic infections, gonorrhea, bacterial septicemia, and etc. What are the possible side effects? Swelling, redness, pain, or soreness at the injection site may occur. Also, loss of appetite, nausea, vomiting, diarrhea, or headache. What are the possible interactions? As ceftriaxone has no severe interaction with other drugs, but may include calcium acetate, calcium carbonate, calcium chloride, calcium gluconate, and citrate. Means uh, do not use calcium containing drugs or do not use calcium for reconstitute the injection of ceftriaxone, because there may be a chance of precipitation between ceftriaxone and calcium, and then it will become a severe problem. That's why we have to avoid co-administration of calcium containing drugs, or we have to avoid reconstitution of our injection with calcium containing solution like ringer solution, etc., so that we can avoid the interaction between ceftriaxone and calcium. What are the possible contraindications? Contraindication means known allergy to cephalosporin class of antibiotics. Neonates less than 28 days, hyperbilirubinemic neonates means should not be treated with rosifin means ceftriaxone, because it can displace bilirubin from its binding to serum albumin, leading to a risk of bilirubin encephalopathy in neonates. So we have to avoid ceftriaxone in neonates less than 28 days. Also, premature neonates is also not receive should not receive ceftriaxone um, up to a certain age. What is the caution? Low concentrations are excreted in human milk, so use caution when administering to the lactating lactating mothers. Okay, what is the toxicity of ceftriaxone? Ceftriaxone sodium causes hepatotoxicity with increased AST, ALT, and ALP levels reported in 3.1 or less than 1% patients, respectively. Mechanism by which ceftriaxone increases hepatic transmembrane levels independently of ALP are unknown, but because hepatotoxicity is rare with the use of cephalosporin, the mechanism of toxicity is most likely idiosyncratic. Also, maybe cephalosporin have been associated with hepatocellular cholestatic abnormalities. What is the dose adjustment? No such dose adjustment is necessary for patients with impaired renal or hepatic function, but we should monitor the patients blood levels of patients who are on dialysis. Also, adults with both renal and hepatic failure should not receive more than 2 gram per day. Means if you are giving less than 2 gram per day, it is okay, but uh, those who are renal or hepatic failure should not receive more than 2 gram per day. What is the irrational use? As we know that antibiotics are irrational use everywhere, so ceftriaxone was considerably higher in the emergency ward than medical wards, and a higher proportion of inappropriate use made its irrational use, like in the treatment of pneumonia and spontaneous bacterial peritonitis. It is inappropriately prescribed in clinical settings, especially where there is lack of clear diagnosis, which can lead to the emergence of bacterial resistance to ceftriaxone, particularly E. coli and Klebsiella pneumoniae, and it is one of the emerging global public health issue. As we know that empirical use for suspected infection and prophylactic preoperative injections are the reason for irrational use. Means if you are giving any kind of drug without any clear diagnosis, without any clear knowledge, you are just giving the drug, it's making irrational use. So we have to avoid the drug giving the drug in which we don't know what is the organisms. Means without clear diagnosis we don't have to, yeah, we should not give cephalosporins or other antibiotics. We have to avoid this practice. Okay, what are the alternatives of ceftriaxone? As we know that ceftriaxone is a third generation cephalosporin, so also we have other alternatives to ceftriaxone. Cephtrioxone, which can be used as alternative to ceftriaxone because it is third generation cephalosporin and same antibiotic activity, same route of administration, safety profile, but it needs to give 3 times a day. Cephtrioxone is another alternative of ceftriaxone because good for treating many bacterial infections, but the plus point is it is available as liquid suspension and tablets. Ciprofloxacin, which is a good and cheap antibiotic that treats many types of bacterial infection, available in different forms including IV. That's why used as an alternative to a ceftriaxone. अवेलेबल डोजेज फॉर्म एंड स्ट्रेंथ इंजेक्टेबल सॉल्यूशंस में हमारे पास 1 ग्राम पर 50 ml, 2 ग्राम पर 50 ml एंड पाउडर फॉर इंजेक्शन 250 mg, 500 mg, 1 ग्राम एंड 2 ग्राम. ओके, व्हाट इज द फार्माकोनॉमिकल पॉइंट ऑफ व्यू से अगर हम देखें तो हमारे पास सेफ्ट्रियाक्सोन की ब्रांड्स पाई जाती हैं पाकिस्तान में. हाई प्राइस में भी हैं, लो प्राइस में भी हैं. हियर इज द हाई प्राइस रोसिफिन IV 500 mg, सिफोक्सोन, क्यूजोन, और लो प्राइस में हमारे पास गिटोफिन, हाईवे, मर्सिडीज. ये हमारे पास डिफरेंट प्राइसेस और डिफरेंट स्ट्रेंथ में हमारे पास ब्रांड्स जो हैं वो अवेलेबल हैं. व्हाट इज द एंटीडोट? There is no such specific antidote of ceftriaxone, but if you are using ceftriaxone more than recommended dose, then if any symptom, any adverse reaction occur, then we have to treat accordingly. With the symptoms. Otherwise we don't have such antidote of ceftriaxone. So the treatment of overdosage of ceftriaxone should be symptomatic. Okay, here we have a case study of a 37-year-old Indian male patient who comes to the emergency department with complaints of cyclic fever, chill, fatigue and severe headache, abdominal pain, but he is not suffering from nausea, vomiting and diarrhea. His travel history is significant for recent 2-month vacations to India. On physical exam, he is ill appearing with dry mucous membrane but has no aversion to light or neck pain. Vital signs are the temperature is 102, 103 Fahrenheit, heart rate is 60 beats per minute, blood pressure is stable. Physical examination signifies splenomegaly and hepatomegaly. Lab tests include WBC is this. Liver function tests are mildly elevated. Blood and CSF samples were collected and sent to microbiology lab for a gram strain culture. When we receive blood samples, then his samples are positive for gram negative rods. The identification of organism by MALDI top was Salmonella group. So the diagnosis of Salmonella serotyphi was confirmed. So here we have question that why history of present illness, clinical presentation and findings with the diagnosis of typhoid fever, and what should be the possible treatment. Here we prepare soap notes according to our case study. What is the subject? Chief complaint, high fever. When we come to the emergency department, he have high fever, fatigue, chill, headache and pain. His age, gender and history. He has recent history of travel. Vital signs, in object we have vital signs. Temperature is 102 to 103 Fahrenheit, heart rate is 60 beats per minute, blood pressure is stable, and blood culture for gram negative rod positive hai for Salmonella serotyphi. So by his all findings and vital signs, and when he's come his physical finding, what we have assessed, patient recent travel history and his positive test for Salmonella serotyphi tell us that he has typhoid fever, because his clinical presentation shows classical signs and symptoms of enteric fever. Because in typhoid fever, so symptoms, what we have: abdominal pain, chills, fatigue, headache, splenomegaly and hepatomegaly. Also his low WBC count and elevated liver function. The infected organism of which humans are the only known reservoir is transmitted by food or drink contaminated with feces or person to person contact and has a low infectious dose. So it is most likely that he has developed his infection during his vacation, because contaminated food and water or close contact with infected person can cause typhoid fever very rapidly. So maybe it is possible that when he was on his vacation, he developed this infection. Main thing, what is our plan? First, our plan is to use the effective therapy which reduces fever and other symptoms, like within 3 to 5 days with acceptable regimens, which the symptoms should be clear. within 7 to 10 days, all things should be okay. Also, our plan is to prevent the relapse of infection. As we know the organism, then we have to start the standard treatment of typhoid fever. So, treatment started with ceftriaxone, which appears to be safe and effective in the treatment when administered single dose of 2 gram daily or twice daily for 7 days until the blood cultures become negative. Also, we should do close monitoring of patient to rapidly detect any complication, लाइक एब्डोमिनल पेन ज़्यादा हो जाता है या डिहाइड्रेशन हो जाती है. अगर इस तरह की कोई भी कॉम्प्लिकेशन होती है तो हमें फ़ौरन से पेशेंट को जो है वो हॉस्पिटल के अंदर या हमें फ़ौरन से रिपोर्ट करना चाहिए, इन कॉम्प्लिकेशंस को देखना चाहिए और बार बार हमें मॉनिटर करने चाहिए अपनी सारी रिपोर्ट्स को, सारी चीज़ों को. Also, prevention is better than cure. So, safe drinking water, improved sanitation, and adequate medical care can prevent and control typhoid fever. Unfortunately, in many developing nations, these may be difficult to achieve. For this, some experts believe that vaccines are the best way to control typhoid fever. So, two vaccines are available. One is given a single shot at least 1 week before travel, and one is given orally in 4 capsules, with 1 capsule to be taken every other day. Neither vaccine is 100% effective. Both require repeat immunization because of their effectiveness wears off over time. As we know that vaccine won't provide complete protection, so we have to follow some guidelines like wash your hands properly, avoid drinking untreated water, and avoid raw fruits and vegetables, choose hot foods, know where the doctors are, and also take antibiotics on your time, avoid handling of food and close contact with infected persons, etc., so that we can avoid this type of infections and we can prevent this type of infection. So, Jazakallah, that's all with my presentation. Thank you very much. Allah Hafiz.